Assalamu alaikum. Welcome to Anatomy Department of Tanta Medical School to discuss the posterior abdominal wall, the anatomy of the kidney and ureter. Objectives. At the end of this session, you should be able to define muscles of the posterior abdominal wall, to enumerate the arteries, the veins, the nerves of the posterior abdominal wall, to describe rapidly the anatomy of the kidney, and to describe the anatomy of the ureter. The posterior abdominal wall. This is the section to show the posterior abdominal wall. Here is the psoas major muscle, here is the quadratus lumborum, and here is the erector spinae muscle. The muscles of the posterior abdominal wall are psoas major and minor, quadratus lumborum, and iliacus. Rapidly, we remember the lumbar fascia. It is formed of anterior layer, middle layer, and posterior layer. Psoas major muscle. Psoas major muscle. We describe the origin, the insertion, the origin, as you see, from the transverse processes of the lumbar vertebrae, and from the sides of the bodies of the lumbar vertebrae and intervening discs, and also by tendinous arches over lumbar vessels. It is inserted to the lesser trochanter of the femur. Psoas major muscle is supplied by upper 3 lumbar nerves, and its action can flex the thigh, can flex the trunk, and if one muscle acts alone, it will produce lateral flexion of vertebral column. The second muscle is the quadratus lumborum muscle. The origin from the iliolumbar ligament and the posterior third of the iliac crest, inserted into the last rib, and transverse processes of the upper 4 lumbar vertebrae. Nerve supply by the subcostal nerve and lumbar nerves. Its action: if both muscles act, it will extend the flexed vertebral column. it will extend the flexed vertebral column. Second, if one muscle of one side, it will produce lateral flexion of vertebral column, and also it fixes the last rib during contraction of the diaphragm. The other muscle is the iliacus muscle. Takes origin from iliac fossa and inserted into the lesser trochanter. Its nerve supply from the femoral nerve and the abdomen. Its action, flexion of the hip joint. Psoas minor muscle is a small muscle that may be absent, and it is inserted to the pectineal line and produce flexion of the spine. Important subject is the arteries of the posterior abdominal wall, starting by the very important vessel in our body, which is the abdominal aorta. What is the origin of this abdominal aorta? It is the continuation of thoracic aorta as it passes through the aortic opening of the diaphragm at the lower border of the last thoracic vertebra, where it becomes abdominal aorta. It descends in front of the lumbar vertebrae to end at the lower border of the fourth lumbar vertebra by dividing into two big arteries, that is to say, the two common iliac arteries. Some relations for the aorta can be observed rapidly from this diagram. Posteriorly, it is related to lumbar vertebrae, intervertebral discs, anterior longitudinal ligament, and lumbar veins. On the left side, it is related to the left cross of the diaphragm, left celiac ganglion, left sympathetic chain, and duodenojejunal junction, and the fourth part of the duodenum. These structures are on the left side of the abdominal aorta. Most important are the branches of the abdominal aorta. They usually divide it into single branches and paired branches. The single branches are the celiac trunk, the superior mesenteric artery, the inferior mesenteric artery, the median sacral artery. The celiac trunk, it arises from the front of the abdominal aorta at the upper border of the lumbar vertebra number 1. Supplies the foregut. The second branch is the superior mesenteric artery, arises also from the front of the aorta at the lower border of the first lumbar vertebra, supplies midgut. While the inferior mesenteric artery is the third branch, which arises from the front of the aorta at the level of the lumbar vertebra number 3 and supplies the hindgut. The last single branch is the median sacral artery, which arises from the back of the aorta at the level of the fourth lumbar vertebra and supplies the sacrum, rectum, and the anal canal. Look also disease paired branches: inferior phrenic arteries, middle suprarenal arteries, renal arteries, gonadal arteries, lumbar arteries, common iliac arteries. Median sacral artery is famous by its end as a mass called glomus coccygeum in front of the coccyx, and gives these branches first pair of lumbar arteries and talks to the sacrum, and also supplies the rectum and the anal canal. The paired branches are the inferior phrenic, middle suprarenal, renal, gonadal, lumbar arteries, common iliac arteries. We should know their levels and main supply and branches. Look to this diagram. Some of the paired branches, they are inferior phrenic, middle suprarenal, renal. Other branches are gonadal, lumbar, and then the common iliac. Paired branches, again, inferior phrenic, middle suprarenal, renal, gonadal, lumbar arteries, and terminal branches, which are the common iliac arteries. The description of these branches, you can review the text. Gonadal arteries. As an example, they are the testicular arteries in the male and the ovarian arteries in the female. Testicular arteries arises of the second lumbar vertebra, descends on the psoas major, crosses the middle of the external iliac vessels to pass in the deep inguinal ring to descend to supply the scrotum, to supply the testes. Then the ovarian arteries. The ovarian arteries also arise opposite the second lumbar vertebra, descends as the testicular artery till the pelvic brim, where they cross the middle of the external iliac artery, passes in the suspensory ligament of the ovary, passes through the broad ligament, then the mesovarium, to reach the ovary. They give branches to the ovary, to the fallopian tube, to the uterus, and to the ureter.